How do we handle upset, angry patients? We've all come across patients that come to our office. They're not happy to be there. They're upset with their last dentist. They're upset with anybody but themselves that they're in this pain. It's your fault. At least that's how they want to frame it. And there's a couple things that we really want to realize. One, when they come across that way and they're angry, they're upset, usually it's because they're scared. Almost always it's because they're scared. And they could be 50, 60, 80 years old. It doesn't matter their age, but they're really coming across as a scared little boy, a scared little girl. I think of, this guy may be a 250-pound lineman looking football player, but he tattoos all over his arms. And yet he's still a scared little boy holding his teddy bear because he's in pain. He was up all night, not happy to have to pay for treatment that he wasn't planning on. He was planning on using his money for other things. And if you kind of frame it in that way, it really helps everything else to realize that they're probably, and almost always, they're really not angry at you. They're not angry at the dentist. They're just upset and they're scared. And so if you can frame it that way, it helps everything else. Next is to be empathetic. What I like to do when a patient comes in and they're kind of spewing out their venom of they're upset is say, I totally understand. It's no fun when you have a toothache or you're in pain. I can completely relate. And now let's see how we can make things better. And by framing that, you're acknowledging that they're in pain, you're empathizing, you're not also taking the monkey off their shoulder, because they a lot of times want to pass their problem onto you like it's your problem. It's not your problem. You're there to try and help their problem. You're there to try and make them better. But at the end of the day, they can choose to get treatment. They can choose not to get treatment, and they're going to be in pain and not getting sleep the next night, but you won't be. And so you don't need to take their monkey, but you do want to be empathetic. You want to empathize with their pain, with their situation, and our goal is to try and make it better. So once you say something like that, the next thing is to just listen. Really, we've been told that we have 2 ears and 1 mouth, and that's for a reason, that we really want to try and listen more than we talk. Listen to what's going on, especially if you can get them back. I like to do this in the back in an operatory more than in the waiting room. So as soon as we can get them back and say, hey, why don't we get you back and see how we can take good care of you, get them back in the operatory as soon as you can. And then be empathetic, listen to what's going on, tell me more about what's bothering you, and just listen. And they will vent. Some will be pretty quick. Some may go on for minutes or many, many minutes. Hopefully if it goes too long, there's ways that you can kind of reroute politely. But you do want to just let them get that venom out. Let them spew what's bothering them, get that out. And a lot of times that alone almost solves the problem and diffuses the situation, because they're able to get their anger out and they realize, hey, you're just there to try and make things better, try and help them. And so once you do that, then it makes it easier to say, well, why don't we see if we can figure out what's going on, what's causing the pain, and make it better. How does that sound? I like that. How does that sound? Because it's kind of bouncing back to them. Hey, why don't we see if we can fix it? How does that sound? Because it's saying you're giving them the option. They can say, no, I want to walk out the door. That's fine. But if they say, yeah, how's that sound? Yeah, let's do it. Then they're already starting to say yes. And it's one of the first steps for them to accept treatment is, hey, we're trying to help you. Let's see what's going on and see if we can fix it. How's that sound? So these 3 steps, again, just in review. 1, think of them as a scared little boy, scared little girl, and that's going to help frame it the right way, because really, that almost always that's what's going on. They're really not angry. They're more scared. And then 2nd, let's bring them back to the operatory. Let's get you back, see how we can make things better. Be empathetic. I'm so sorry to hear that you're in pain, that this is bothering you. Why don't we get you back in the operatory and see what's going on so we can hopefully fix it? Listen, use our 2 ears, really listen, let them vent, let them get out whatever is bothering them, and then circle it around to, why don't we get the doctor back? Let's see how we can make things better. How does that sound? And then again, you're acknowledging that they have that choice, and everybody loves choices. So hope that helps. and a good way to help handle and diffuse an angry patient.